Hello, welcome to Giving Tuesday. I'm Angela Harris, Vice President of Community Engagement, Programming and Communications with DCTV. Washington, D.C. is home to over 12,000 nonprofit organizations. This represents over a quarter of the district's workforce. D.C. nonprofits give nearly $500 million annually to the district for a variety of services, and that doesn't include the countless hours of volunteer work done in our community. DCTV is committed to meaningful media. That means we proudly give a voice to those who are the least heard, and we speak meaningful dialogue about the important things that impact our community. In 2019, DCTV launched a new grant program for the purpose of helping nonprofit organizations to increase their communications capacity. We developed the grant with the guidance of nonprofit leaders who told us that getting the word out about the work they are doing is amongst the biggest challenges that they face, especially in a hyper-digital world. So we are here today to tell these stories, to make sure that these meaningful messages are seen and heard. Giving Tuesday is an annual event that began in 2012 as a way to spark the holiday giving season. It's celebrated on the first Tuesday after Thanksgiving each year. We hope that today's 24-hour special programming event will inspire you and will give you cause to join these organizations in the great work they are doing every day. So sit back and you'll be introduced to some of DCTV's staff who will serve as the hosts for this one-of-a-kind special event. And happy holidays.
Hello, I'm Lisa Haynes, Communications Manager at DCTV. Research shows that some of the communities in the DC region experience disparities in healthcare coverage. There are many people who seek some form of health and medical support services from the district's nonprofit organizations. The support ranges from addressing mental health issues, disease awareness and prevention, and a host of other services. We'd like to introduce you to 11 nonprofit organizations who are going above and beyond to provide excellent health-related services to the DC community. Over the next hour, you will be introduced to Badges United Foundation, Healthy Babies Project, National Cervical Cancer Coalition, the Parkinson Foundation of the National Capital Area, Humanity 360, SCADD Alliance, the Good Listening Project, Access Youth, District of Columbia Recovery Community Alliance, and the Ronald McDonald House Charities of Greater Washington, D.C. You will learn more about how, collectively, these organizations are making an impact for those who depend on the health and medical support services that they provide.
Nobody ever told me how it was going to feel being constantly exposed to suffering, danger, death.
For the last 3 years, our first responders have been more likely to die by suicide than in the line of duties. And the chances of them dying by 55 by a heart-related illness is 55%. And their overall life expectancy is 20 years less than the general population. So their lifetime of service to our community is coming in at a very large toll to themselves and their families.
I'm a first responder from 9/11. I've lived through the sniper attacks in DC. I've been in numerous, fatal deaths, children deaths, suicides. I've had 2 of my fellow officers kill themselves. All this stuff over the years adds up. And I think that specifically for first responders is where all this tension and trauma comes from.
Badges United Foundation is a nonprofit organization that focuses on offering a variety of services to first responders and their spouses to hopefully improve their mental health and their overall well-being. Our #1 mission is to try to decrease first responder suicide. And by bringing awareness and building their social support from a population that is always really putting others first instead of themselves, when they really need to be able to take care of themselves first.
I hope that he just grows and continues to raise awareness and do more and better things.
Badges United Foundation. In this family, we fight together.
Are you looking for lower energy rates or renewable energy sources like solar and wind? DC Power Connect can help. District Energy customers can now shop online at dcpowerconnect.com for their energy supplier. DC Power Connect is an online tool that gives DC consumers the power to choose the right energy plan for them. Visit dcpowerconnect.com and find out how you can shop for your energy today. DC Power Connect, your energy, your choice.
The initial mission of the agency was to combat infant mortality. I decided that I wanted to focus on the youth serving population, just the teen moms, because I saw the teen moms were struggling to find a safe place to lay their heads. Some of the moms had to sell their bodies in order to find a safe place to lay their heads. Our core values are about empowering our moms, educating our moms, mentoring our moms, guiding our moms to be able to change the trajectory of that mom's life and that child. What sets us apart is basically being able to keep a pulse on what's going on with all of the girls and everybody on the staff, including myself, keeping a hands-on approach and being very engaged.
You can come to them about anything. They'll help you with anything, or at least give you the information that you need to get from A to B.
Healthy Babies has helped a lot, especially like, for example, the Christmas sponsors. I've never heard of a program to do something that deep, and you don't even have to live here and still get a bunch of Christmas gifts and get help. I feel like this is one of the best programs out.
Healthy Babies will never turn your backs on them. And I'm grateful for it. I know a lot of young girls who's not aware of it will be grateful to know that it's in the community.
This is Impact Moment right here on DCTV. I'm Alvin Jones, and it is my pleasure to introduce to you a lady that you may know, but if you haven't known until today, consider yourself fortunate because you now get to know her. She is the executive director of the Healthy Babies Project, and I've worked with her and seen her great accomplishments. Regina Ellie, how are you?
I'm doing good, surviving in this COVID time.
Yeah, you know, we had to social distance, but we're still close and we're still getting together. But let's talk about Healthy Babies, what it's been doing, what's going on right now, especially with COVID.
During this time of COVID, we've seen people go beyond the extra mile. You know, groups like, Hoops for Youth Foundation, who called us to see how things were going and ordered everything that we needed, all the PPEs, the personal protection equipment, and every week would deliver tons and tons of stuff over to us. They were were very active when one of our youth graduated and even provided a scholarship when one of their friends passed away, Jim Lyons. And they provided her with a scholarship to finish up college. And so Dakota graduated in June, and everybody from that foundation was present to watch virtually her graduation. And, it was an exciting time for us. Dakota is one of the first moms to graduate out of college from our program, and her story and her journey is definitely a challenge, but Dakota said she was able to come through one door and go through many doors.
Before we do anything else, a big DCTV shout out to Dakota, who's graduated.
Woo, Dakota!
Where did she graduate from?
She graduated from the University of the District of Columbia.
UDC.
Yes.
UDC. Congratulations, Dakota. We are extremely proud of you. And even though they got masks on, all of the crew right here, they're smiling because we are all right here for you.
Dakota is one of the first moms to graduate out of college from our program, and her story and her journey is definitely a challenge, but Dakota said she was able to come through one door and go through many doors. And while the pandemic has been challenging, it's shown us that, I mean, humanity can, in the midst of chaos, they operate from a place of their heart. And so we've had people bring foods. We've had David and Carrie Marriott, who were the first group to bring us food. Then Fair Chance introduced us to Families for Families, and they started bringing food every 2 weeks for the moms. We have churches that have bought gift cards, different items, and the list just goes on.
How did you get involved with this whole project? Where did it come from?
Years ago in high school, my friend reminds me that I had stated to her that I always wanted to work in an organization that worked with youth, in particular pregnant and parenting youth, because I believe that when you're working with young people, you're able to plant seeds that'll hopefully change the trajectory of not just their lives, but the lives of their babies. And it goes back to, what Dakota said, that people, when you come through the door, just, be still and stay and listen. Because that one door will lead to other opportunities.
Jean Ellie, thank you so very much for all of the things that you've been doing with Healthy Babies.
Thank you. Thank you, DCTV, for just giving us the opportunity to be able to talk about, what we're doing in this day and age and how the community as a whole, regardless of zip code, has come together, and regardless of color, has come together to uplift and to assist. So thank you so much.
All right. So that's another Impact Moment for DCTV. I'm Alvin Jones. Thank you for watching.
HPV, or human papillomavirus, causes 6 different types of cancer. The most common is cervical. 12,000 women will be diagnosed with cervical cancer this year, and many of them will die.
The National Cervical Cancer Coalition is a grassroots, volunteer-led program through the American Sexual Health Association that supports the personal experience of women and girls who are experiencing HPV and to prevent cervical cancer. What surprises me the most about the work that I do is how many people are still not aware of what HPV is, and then also the low response rate when I tell them that women are dying from cervical cancer, which is the most preventable cancer. Though we do have pap smears and HPV tests and co-testing, there is not yet a test to test men for HPV. And we typically find out that they have a HPV-related cancer after they find out that they have cancer.
Men should care about this because they can get cancer. Their wives or sisters can get cancer. So we should take this as a community issue, not an individual. It's an individual, family, and community issue in my mind.
So being that we do now have a vaccine that is good for boys and girls, so men should be aware, because there's no way to really know that you have HPV unless you have HPV-related cancer.
For more information, go to our website, nccc-online.org.
Wash your hands, avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Welcome to Impact Moment right here on DCTV. I'm Alvin Jones, and we are still social distancing. Today, we have the pleasure of sharing with you information from the Parkinson's Foundation of the National Capital Area, and with me is the CEO, Jared Cohen. How are you doing?
Doing great. How are you doing today, Alvin?
Great, great. Welcome, and thanks for coming out and sharing with us for Impact Moment right here on DCTV.
Thank you for having me.
Now, there's a lot of foundations that have the name Parkinson and foundations on them. And so I don't want people to get you confused with other foundations. Let's talk about the Parkinson's Foundation of the National Capital Area, what it does and how it differs.
Great. Once again, hello everyone. So my name is Jared Cohen. I'm President and CEO of the Parkinson Foundation of the National Capital Area. And our foundation provides programs and services to help people slow the progression of Parkinson's disease. So we're based in Silver Spring, Maryland, and we serve about 2,500 people a year.
Now, most people have been made aware of Parkinson's disease because of the fortunes of former Attorney General Janet Reno, Michael J. Fox, and Muhammad Ali. But from what I understand, this disease has been diagnosed since, what, 1817?
It's more than 100 years.
Wow.
And we don't know how people get the disease or why they get the disease. There's lots of theories as to how that could be. But once they get the disease, there's no cure for the disease, but there are things that people can do that are evidence-based that help slow the progression. And that's what our foundation is all about, is we're about giving people tools and resources to fight Parkinson's disease, to slow its progression, and to have as high a quality of life as you can with the disease. The disease is one that impacts everyone differently, and it could impact people in their early 30s, but most people are diagnosed in their 60s or later. So you can imagine someone who's 35 and diagnosed as early onset Parkinson's would have a much different course of the disease than someone who's diagnosed at the age of 89. So it's a really difficult question to answer because the disease impacts everyone so differently. One of the challenges of doing programming for people with Parkinson's disease that we do, and I'll talk more about that, is providing services that can support a wide variety of people at different stages of the disease.
What about the families? How does the Parkinson's disease affect families?
So the Parkinson's impacts certainly a spouse or a primary care partner who's dealing with supporting their loved one almost every day, depending on their needs. Some people need extensive support, some people maybe not as much. And then adult age children as well, it impacts them as well.
How long have you been the CEO of the foundation?
Since 2013.
What do you find is your biggest challenge?
I think our biggest challenge is being able to provide our work in a sustainable way, because the work we provide, which is direct service programming, people often want it closer to where they live. As a small foundation with limited resources, how do we allocate our resources to the community to be able to serve as many people as possible? And as an example, we will work months and months and months to start a new exercise program to help people with Parkinson's in a certain town or community. And the next week our phone will ring off the hook of people asking us to add one in their town or community because they want it closer to where they live. So the challenge is, how do we add our programming to serve people and do it in a sustainable way?
So what you're telling me is you're a victim of your own success, that your services are needed, they're appreciated, and now more people want them.
That's certainly right. So before the pandemic, PFNCA was providing more than 300 wellness classes a month at no cost for people with Parkinson's disease from Northern Virginia through Baltimore County, Maryland, including many in Washington, D.C., Montgomery County, Howard County, etc. In response to COVID-19, our programming is now offered all online via Zoom for our wellness classes. We're currently offering about 120 classes a month that are focusing on exercise, and various types of exercise, seated exercise, boxing, dance, and then we also have programming that focuses on vocal cord strength, because so often people with Parkinson's, their vocal cords deteriorate over time as one of the ways the disease impacts them. So we want to have them working with a speech therapist who understands Parkinson's to strengthen those vocal cords. In the short term, it's going to have them speak louder, but it's also going to strengthen those vocal cords to avoid choking. Sadly, people with Parkinson's often have complications from choking, and they could pass away from choking, which is a complication of Parkinson's when their vocal cords deteriorate. So by providing classes that focus on communication skills, we're giving people tools to strengthen those vocal cords.
Wow. What kind of help do you need right now?
I think that one of the biggest things that we need is for people to learn what we do and how to engage with us. So I'm hoping that maybe some of your viewers will learn about our foundation. They may have a neighbor or a relative that has been recently diagnosed and doesn't know where to turn. And they could visit our website, which is pfnca.org. and they could learn more about our foundation and about the services we provide, because there's a tremendous need, but I think that sometimes as a small charity we have a hard time getting the word out about what we do and how we can help.
That is the Parkinson Foundation of the National Capital Area. Thank you so much, Jared, for coming on the show.
Thank you for having me.
And then once again, it's another Impact Moment right here on DCTV. I'm Alvin Jones.
Hi, my name is Adrienne Quinn. I'm a freelance camera operator, producer, and director. If it were not for DCTV, I would not be where I am today. A few years ago, I transitioned careers. I was referred to DCTV during that time as a place to just see if this was what I wanted to focus on and return to school to study. I was fortunate to build a foundation of skills through the classes, state-of-the-art equipment, and volunteer experiences. Now, I am making a living doing what I love. This is my DCTV story. DCTV is meaningful media making an impact.
Hello, welcome to Impact Moments right here on DCTV. I'm Alvin Jones, and today we have the pleasure of sharing some time with Shantice McKenzie. She is the head person of Humanity 360. How you doing?
I'm doing wonderful, man. Thank you for asking. So a little bit about Humanity 360. It was founded by myself in 2014. I was a teacher at the time. I wanted to replace suspension and expulsion rates with meditation.
So instead of putting them in timeout, we're gonna, okay, it sounds like you're a little upset. Why don't you go meditate?
That's right.
And just relax and get them calmed down.
The premise is that we were never taught coping skills.
Yeah, because it's just like we know when you have a kid, you know when it's time for a nap. And
Or
the
do you?
more noise that child makes, you go, you're sleeping, I'm not sleeping. And the next thing you know, they're like, and they're down.
So I saw an immediate impact in my classroom as a teacher. And so that led me to the more broad idea that not only are children not able to cope with some stressful situations, but there are a lot of adults who can't cope with stressful situations.
I've seen sheriffs come in and say, look, in our department, we teach our sheriffs and our deputy sheriffs how to recognize when a person is stressed. And the first thing is understand this person may not have a criminal problem, they may have a mental or emotional problem.
You are taking the words out of my mouth. This is real.
You and I, we just like here. We may be socially distancing, but we're right here, right next to each other.
Oh my goodness.
Yeah.
With the understanding of mental wellness, we can implement these programs in so many different places, not just in the police department, but in other areas where people are dealing with people who are experiencing stressful situations. And so it's not just a remedy for a police department, it's literally the remedy for humanity, hence the name Humanity 360.
All over the world.
All over the
Everywhere
world.
you turn.
Everywhere you turn.
360.
It's needed. It's needed. I went to sleep one night and had a vision, and I woke up with notes in my phone that were very specific about how I needed to go about this Humanity 360 organizational mission.
Oh, so you were trying to get away from this, you couldn't.
I did, exactly.
You couldn't.
Do you see what I'm saying? The way we're gonna change these interactions between each other and change the way to change our mental capacity is gonna be through love and understanding. First for ourselves and then for others.
Because if you don't love, you can't get anything done. And so what you're trying to do is you're trying to remove all the barriers that come into people's minds and thoughts.
That's it.
That they can't love themselves.
You can reach Humanity 360. Our website is humanity360for365.org. We also have social media links or accounts. Our Instagram is Humanity 360 for 365. Our Facebook, Humanity 360 Incorporated. And also we have a Twitter account, Humanity 360 FOR1. We would love for you guys to reach out so we can speak more about what we do in our programs and how we can better assist anyone. I mean, this is for anyone. It is not just for a specific person. We can find something that will fit any capacity of your mental wellness. Wherever you are, we can meet you there.
Wow, that is amazing. Shantice McKenzie, thank you so very much for coming on.
Thank you.
You are changing humanity in a big way 360 all over the globe.
That's right.
There you go. So this is why we come to you with Impact Moments, because of people like Shantice. For DCTV, I'm Alvin Jones, and this has been another Impact Moment.
Please listen to this message in its entirety. There is currently a motion being filed to suspend all bank accounts and tax returns bearing your name and social security number. To review immediate rights and details and avoid all further proceedings, please contact our firm at 1-844-898, or you may press 1 to be transferred to your case manager immediately.
I'm Michele, Member Services Coordinator at DCTV. I stand against racism and bigotry because they're wrong. My greatest concern is for future generations and the lessons we're teaching them. For change to happen, we have to start at the most basic level of society, which is family, because many of us value that the most. We all want to see our families prosper and be great citizens of the world. We all are human beings in this journey of life together. And of course, all lives matter. However, Black lives are disproportionately endangered due to hate, brutality, and violence. Systemic racism still has a devastating and generational impact on the Black family. My first awareness of when my skin color was an issue in society was when I was about age 6 or 7. Since my toddler years, my family and I would take an annual summer vacation. One year, my sister and I were so excited to play with a neighboring family's granddaughter. She happened to be white, and we'd first met her and played with her the summer before. During the returning summer, our playmate told us that she could no longer play with us. When we asked why, she said it was because we were Black. In the span of 1 year, our playmate had been taught racism and how to spread it. That was a painful experience that's still with me today. Parents shouldn't have to have the talk with children so young to explain racism, but it's still a reality in the Black family today. Working at DCTV, I can leverage my voice for change. Knowing that I'm part of an organization that shares my values and desire to stand against racism and hate is very rewarding. So, I'm raising my voice to speak up for change, hoping that the next generation can live in a better world. Our children are watching. I have a voice. I have a story. I am DCTV.
Welcome to Impact Moment. It's all for you right here on DCTV. I'm Alvin Jones, and today I have with us Catherine Leon. She's with the SCADD Alliance. Catherine, how are you today?
I'm doing well.
Listen,
great to be here.
It is so good to be here. We're social distancing, but we are keeping things close as far as information. Let folks know about the SCADD Alliance and what it does and how it helps people.
Okay, great. First, I probably should explain what SCADD stands for.
Yes.
It's spontaneous coronary artery dissection, and it's a form of heart attack that most people and even most doctors have not heard of yet. Hopefully, over time with more research, we will get the message out. But the reason that's not known about so far is because of the history of medical research. You know, in the past, they would study men's heart attacks and apply that information to women. But obviously that doesn't work because we're very different beings, even down to the cell level. And with SCADD, what happens is the artery lining tears. So it really is just kind of a rip in the artery layer that can cause a blockage between the layers of the arteries, or it can just spiral out and cause a very dramatic situation. So some folks do end up with sudden cardiac arrest. But for the most part, it is a heart attack that affects younger women who don't have risks for cardiovascular disease like you would normally think of. The blockage can either be the cause of it or a kind of a form of blood clot. And because it strikes out of nowhere, that's why it's so devastating. You know, a lot of times it happens after a woman has a baby, which was the case with me. I was 38. I already had one son who was 20 months old. And a few weeks after I gave birth, I just had these horrible symptoms. I kept asking for help, and none of the doctors I spoke with had any idea what was going on. And sure enough, I had a blockage, 90% blockage of my left main artery, and ended up having double bypass surgery.
Wow. That has to be frustrating, and well, frustrating I think is a word that almost describes it, but also disheartening when you have a problem and nobody knows what to do or where it comes from. There are no answers.
No, particularly at that time, there really was nothing. That became my mission to change that. I really felt like if we were studying every aspect of health in men, that it was about time we started studying this form of heart attack in women. So over time, I was able to initiate some research at a medical center, and then a few years later, I developed my own nonprofit SCADD Alliance to continue spreading awareness and support for patients and families, but also to ramp up the research project.
Since your first heart attack under this SCADD scenario, what have we learned?
We've learned a few very good basic facts about SCADD. We do think that it predominantly affects women. Men do have it, but at a lesser rate. We think that there is a correlation with another condition that affects the vascular system called fibromuscular dysplasia. So that's the cause for some people. We do think that hormones are involved, because in women it typically is either with, we think, pregnancy, in vitro fertilization, and the menopause years seem to also be a culprit. But then also stress, which is kind of an interesting area to think about, because it's not just emotional stress, it's also physical stress. So we think some people have a combination of all these different issues, like it's like a perfect storm type of a scenario. So the best message for women is to listen to their bodies and, really know your family medical history and think about what types of issues might have happened in your family, whether you had some unexplained sudden deaths or people who had strokes or chest pain. Learn about your family and then monitor yourself.
How can people get more information?
You can get more information by going to our website, SCADD Alliance. It's SCADDALLIANCE.org. We also have a very active public Facebook page, which again is at SCADD Alliance, and also on Twitter. Not only will you find patient stories and the latest on the research, but you'll find information about our own effort, which is the iSCADD registry. It's a multi-center registry that's independently collecting data. Right now we have 14 sites across the country, and we hope to advance the research through this effort.
So there you have it. More information could be found about the SCADD Alliance. All you have to do is go to their website. Catherine Leon, thank you so very much for coming on Impact Moment.
Thank you. I was thrilled to be here.
Oh, it was our pleasure. And we, like I said, we're social distancing. but we're also getting out some very good information. So we appreciate you coming on the show and letting people know about the SCADD Alliance and the great things that you do.
Oh, thank you. DCTV has been a lifeline during the pandemic for me in particular. I've really benefited from your program, so I'm thrilled to be a grantee.
We appreciate the fact that you appreciate us because we're trying to get your appreciation.
It's a win-win.
It's a win-win. So once again, we appreciate the fact that you guys are watching. We appreciate the information that is brought on by people like Catherine and the other organizations that are part of Impact Moment. And for Impact Moment, right here on DCTV, I'm Alvin Jones, showing a lot of appreciation.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Well, our nonprofit, the Emery Beacon of Light, has provided a number of services, and we have the Beacon Clean Team, which we were able to get a grant from the city to hire persons who are looking for jobs. We provide an immigration clinic where we've had a clinic here once a month for people who need help with gaining immigrant status. We have a very popular food pantry that's pretty full on Tuesdays, and the need is tremendous, and we've been running out of food almost every week. We have the Beacon Brightwood Business Alliance, which has provided support for the small businesses up and down Georgia Avenue and other programs. Our whole goal has been to help this community be whole and to help this community be self-sufficient. Brightwood is a tremendous place, and we're just happy to be a part of the fabric of this neighborhood.
Welcome to Impact Moment right here on DCTV. I'm Alvin Jones, and today we're going to be talking with Frankie Aberlin, and he is the CEO of the Good Listening Project. How are you doing?
Good, Alvin. Thanks for having me.
We're listening to you, and because it's good to listen, let's talk about that. Tell us about the Good Listening Project.
Sure. Well, we're a nonprofit. We promote good listening, especially in hospitals. And our mission is about helping fight burnout, promoting nursing resilience, physician well-being, and the humanization of healthcare. We do a few things to help build cultures of good listening in hospitals and other health systems. One is we provide workshops and trainings, but the thing we're most known for is our listener poets. We send listener poets to talk with people in hospitals, most often staff, but also patients and family members. And we write custom poems for them about those conversations. Well, our work is very reflective. So we train our staff to create these spaces where people feel heard and then thus feel human. So a person might sit down in a chair across from a listener poet, or now as we do it online, it's on Zoom, and they have that one-on-one conversation. The listener poet says, tell me your story, or tell me what's on your mind, or what should this poem be about? And very quickly, the conversations get personal. People talk about things that are sometimes heavy. That nurse might sit down and talk about what it means to be working with people who suffer from dementia. Or that social worker might sit down and talk about their niece or their nephew or their daughter that they care so much about and how they just went to the beach together. Our work is essentially to create a space where they feel comfortable in non-judgmental interaction, sharing their thoughts, their feelings, what's on their mind, sometimes saying that for the first time So they're hearing themselves say it for the first time. And then we give them this reflection of what they've just said in the form of a poem.
It's almost like when you go to a carnival or somewhere and you sit down and a person does a caricature of you and they take the qualities and they kind of, some people say exaggerate, or you could say accentuate that character so that when the person sees it, they go, okay, this is kind of who I am. And it sounds like you're doing that with words.
Well, I never thought about that before.
But does it make sense?
Well, there's some aspect to it.
Yeah.
We're telling the person what we just heard them say. And so it's as if a receipt of that conversation. In the trainings that we do for people in hospitals, the trainings that we do with doctors and nurses, we often say the quality of your listening affects the quality of their speaking. And so if you're a doctor, or if you're a nurse, or if you're a social worker, if you can be a good listener for a patient or for a family member, they're more likely to share with you information that could be really valuable to you for their treatment, information about their background, their symptoms, the likelihood of their treatment plan that you're prescribing for them working. We know that that is important for patient safety. We also know it's important for humanization of the healthcare experience. But what's really exciting is it's important for everyone everywhere. It's important for nurses listening to each other, doctors listening to each other, healthcare administrators creating this culture of good listening within their organization.
Your program is very vital in bringing these things together to give people, a better experience when they have to go into the hospital, but also a better outcome.
Absolutely. Also, humanizing the experience.
Thank you.
Every hospital administrator wants to believe that they see their people as full humans. And every hospital starts to drift away from that. And we can help restore that perspective. These people in our hospital are full human beings. They're not just the guy with the leukemia or the woman who has diabetes. They're this full and complete person. They're not just a nurse or the absence of a nurse, the FTE that they're trying to fill. They are a person who is deciding every day if this is the right field for them to work in. When we say we're talking about fighting burnout, we're helping improve nursing resilience, we're helping people who have been drawn to the field of healing, the field of healthcare, or really whatever field that they're drawn to, stay in and continue to do that work they care so much about.
Let's give folks your contact information, how they can reach out to you and find out how they can be a part of this project, this great project.
Thank you. Our website is goodlistening.org, but the real action is on our Instagram. We have a really engaging and I think beautiful Instagram account. It's at The Good Listening Project.
And with that, all I have to say is if you've listened to this gentleman, I just say thank you for watching Impact Moment right here on DCTV. I'm Alvin Jones.
My life was in shambles and I was trying to figure out how to pick up the pieces. AA not only keeps me sober, it helps me live a much better life. If you have a problem with alcohol, contact AA. It works for me.
Bringing new audiences and new approaches to American music of all genres, the American Pops Orchestra is comprised of the most accomplished musicians from the DC region and all along the East Coast. The mission of APO is to build community through the preservation, promotion, and reimagination of American popular music. Through live and virtual performances, educational initiatives, and collaborations, APO makes the highest quality art accessible to the broadest audiences. Our performances are described as inspiring, fun, engaging, inclusive, and innovative. Included in our mission is forging artistic partnerships with underserved youth and their families through arts education and providing a stage for the voices of tomorrow. To learn more about APO, visit theamericanpops.org. Join our family and join the fun.
On Giving Tuesday, December 1st, 2020, DCTV will shine a spotlight on the impact that nonprofit organizations are having in our community. We invite you to tune in for a special 24 hours of continuous programming, highlighting Washington, D.C.'s nonprofit community and the organizations that are making a difference in our community. Tune in morning, noon, and night to be inspired and to witness meaningful media. DCTV is where meaningful media is making an impact.
This is DCTV. Welcome to Impact Moment. Once again, I'm Alvin Jones, and we are on the roof, social distancing, but we're close to you. We're bringing you information about things and organizations and people that are helping you. And today, from Access Youth, we have Jody Agra. How are you?
I'm great. How are you?
Good. Thanks for coming out.
Thank you. Thank you.
Let's talk about your organization, because I understand you guys were one of the first organizations that worked as a mediator for a youth.
So about 11 years ago, I founded Access Youth. And at that time, we had a very high rate of arrests for young people in the district. We had over 35, almost 4,000 young people being arrested every year. And so we were one of the only programs that were an alternative to prosecution for juvenile offenders. So instead of going into the system, they would get diverted into our program, and then we used mediation and restorative justice. And in a lot of those cases, victim offender mediation, where, for example, if there was a fight or there was something going on in the neighborhood, we brought those folks into the police station, conducted mediations there. And the power of mediation is, one, them hearing from the victim on their own. They take accountability. When you look at recidivism, rearrest rate in that program with, almost 2,500 kids going through that program, 90% of them were not rearrested. If you look at kids that go into the system, it's flipped. 90% are rearrested, and most of them become adult criminals.
What is the average age, and what are the age ranges?
We serve youth as young as 7 all the way to 18. And what we found was more and more kids were coming to us as a result of an incident that was happening on school property. So they were actually, as you know, there's police presence in most of our schools. And so when incidences happen, they're arrested, taken in a squad car.
Why is it that when kids, like you said, 7 years old, they get into a tussle or fight or grab somebody's hair, that they get arrested?
What happened is, in the 80s, zero tolerance policies spread across the nation, right? They initially came for drugs and guns, right? And really became a vehicle really for push out, right? So when behaviors happened in schools, particularly inner city schools with majority of students of color, right? There was a disproportionate use, right, of expulsion and suspension, right? And so that's what happened to these kids. Instead of sitting down, talking to someone, talking to teachers, talking to parents, it was much easier to push them out of school. So we found that 70% of the kids we were getting in the pre-arrest program were school incidences. And so back in 2011, came up with, let's get these kids at an earlier point, before they're arrested, before they're suspended, and use our medicine of mediation and restorative justice in the schools. So we place full-time program managers in the schools so that when those things happen, the deans and behavior deans and teachers refer those students directly to us.
Thank you for coming on Impact Moment.
Thank you.
Once again, it's been a chance to connect with organizations and people who are doing things for folks in DC, and Jody and all the folks with Access Youth do that. Thank you for watching Impact Moment. I'm so glad that Jody was on the show, and I'm glad that you had a chance to watch. I'm Alvin Jones, once again, and this is DCTV.
So tell us about your girlfriend.
I first talked to Brittany at a party freshman year. She was really cute, funny, and nice, so I took her out. I bet half the guys at school want to be with her.
So how do you make it work?
I text her a lot, and check her phone, and make sure no one's moving in on her. I made her delete her Snapchat. We're young, and I think she's the one.
A260C amplifies the voices of DC youth through imaginative and effective writing education. Our storefront is Tivoli's Astounding Magic Supply Company, Deluxe Haberdashery and Illusionarium. It allows our students a space to enter that feels distinct from anywhere else that they would be learning. It feels different from home, it feels different from school, but it is a place where true learning happens, and they are members of this space.
I did good in my test. Passed it. Next thing you know, A+.
Our students are authoring their paths forward every time they put the pencil down, every time they step to the keyboard. And I consider myself lucky to be on a team that gets to advance that work here in DC every single day.
Welcome to Impact Moment right here on DCTV. I'm Alvin Jones, and I have with me Mark Lassiter. We are social distancing, but we're still close. Mark is the executive director with DCRCA, which stands for DC Recovery Community Alliance. How you doing, sir?
I'm doing great. Thank you for having me here.
Listen, you know what? This is, with everything going on, your organization is needed because there's a lot of stress going on in people, and it's very difficult for people to cope. How does DCRCA help people cope with situations that could be going on in their lives?
Oh, wow. We provide recovery support services throughout the community. We have been providing these services, for about 10 plus years now. We provide health, wellness, and life skill training. And we provide additional services for people that are suffering with issues related to substance use disorder and mental health issues.
Folks who are having mental health and substance issues, how is this whole pandemic affecting them?
Wow, it's been real hard. This is, you have to think about the COVID-19, the isolation, forced isolation. You're having incarceration with folks, crisis going on.
People have been impacted negatively. How does DCRCA help these folks? Because they're not only the folks who you've been working with, but you're going to get a whole batch of new people who are dealing with issues they probably never had to face.
We try to combat the stigma of substance use issues and mental health issues. That is a major injustice that happens to these individuals. What we try to do is support them, give them the respect that they need, and teach them the skills that they'll be able to not only help themselves, but also continue to seek help.
Mark, have you noticed lately that people are looking at substance abuse differently, with a little more compassion and understanding?
I believe they are. During this time, especially with COVID-19 and the forced isolation, I believe they are looking at a little more compassionately. These are hard times because being forced isolation is a situation that can cause triggers for individuals that have been clean for a long period of time, but it still is a trigger mechanism. So we have to ensure to provide those additional supports to individuals. And that's one of the things that DCRCA does, is provide additional services, especially along those life skills and those coping mechanisms that are needed.
Now that some people are isolated, there's certain triggers that affect them. But what we also find out conversely is that people who've been going out and doing things and buying stuff, those were the things that kept them probably from going off the rail or being in a situation where they seek for other types of comfort. And so now there are people who can't do brunch. There are people who can't go shopping. They can't hang out with their besties. And that may cause some people who may have been in recovery to go out of recovery, but some people who, because they had those coping skills, never got into substance abuse, who may go into substance abuse.
Oh, without a doubt, without a doubt. We are, one of the things that we've been doing lately is reaching out to the hospitals and connecting with the hospitals so we can connect with those clients that are coming into the hospitals, working with the other treatment programs within the city like Psychiatric Institute of Washington, United Planning Organization, RAP Incorporated, Federal City Recovery. I mean, just to name a few organizations that we work with and partner with to provide recovery support service with those organizations, and also to allow the clients to come in and learn what their triggers are that will help them as they move forward in the community.
You've been listening to Mark Lassiter talk about how DCRCA is so important. What do you want these folks to do?
Come to DCRA directly and we can provide services to you. We do a full assessment. We take a look at exactly what is going on with those individuals. We help you identify the goals and objectives that you're looking for. They're not our goals and objectives. We divide a recovery plan that is based on what you need and what your goals are, because we know if we do that, you're more inclined to complete treatment and move forward and be successful in society.
Wow, that's powerful. Mark Lassiter, thank you for coming on Impact Moment. Mark is Executive Director of DCRCA, DC Recovery Community Alliance. That means they get together with other folks and they help other folks. For Impact Moment, I'm Alvin Jones right here on DCTV.
Hey, thank you, Alvin.
Thank you, sir.
When I was young, I was plagued by fear and self-pity.
My life was in shambles.
At first, I never drank on the job, but eventually I did.
Removing alcohol wasn't enough. It left me depressed. That's where AA offered a solution.
I remember sitting in the AA meeting and thinking, I finally found a place where I belong.
AA not only keeps me sober, it helps me live a much better life.
If you have a problem with alcohol, contact AA. It works for me.
And for me.
And for me.
At Hillcrest Children and Family Center, we put our clients first, offering up-to-date clinical services in a confidential, caring environment. Throughout our 205-year history, we have offered primary prevention and mental health services to children and families in the Washington, D.C. area.
We dig deep into the core of the matter to discover the root of the problems and to find best solutions. We pride ourselves on offering the community a continuum of services such as therapy, substance abuse treatment, school-based behavioral health services, and employment and housing support.
Hillcrest Children and Family Center, healing wounds from the past to embrace a healthy future. 205 years of passion and purpose.
Wash your hands, avoid sick people and touching your face. There are everyday actions to help prevent the spread of respiratory diseases. Visit cdc.gov/COVID-19. Brought to you by the National Association of Broadcasters and this station.
Texting is a great way to communicate, even for scammers. And it's pretty simple for them to steal your identity. If any bill collector contacts you, making demands or offering refunds by text message, wait. Don't share any of your personal information, such as account or social security numbers. Hang up and call the provider back with the number on your monthly bill to confirm any charges. Contact the Public Service Commission or the police to report scammers. Fight utility scams. The power is yours.
This is Impact Moment right here on DCTV. I'm Alvin Jones, and it is my pleasure to share with you today the CEO of Ronald McDonald House in the Washington, D.C. area, Karen Torres. Karen, welcome.
Hi, thank you. Thanks for having me.
Well, you know, Ronald McDonald's, I mean, any kid growing up, that's the place to go, that's the place to be. And the fact that you guys created the Ronald McDonald House so that parents would have a place so that they could be and be close to their children. Let's talk about that whole concept.
Sure. Well, our mission for 40 years, this is our 40th anniversary, has been to try to remove the barriers to quality health care for all children. That's our dream, that one day all children anywhere will have the same access to the very best health care possible. And our Ronald McDonald houses help remove those barriers. They allow parents a free place to stay, to have their meals, transportation to and from the hospitals where their children are hospitalized for very serious injuries or illnesses. And we also provide the social support services. Studies have proven that children heal better when they have their support with them, and families do better with their children in the complicated protocols when they do feel supported and rested.
You know, I've been working with childhood cancer organizations, and I know how important it is. And what people don't realize is, in the process of going to visit your child, going to doing all these things, you still have to eat, you still have to take care of these other things. And, and places like Ronald McDonald House provide a place at the end of the day, after being in the intensive care unit for like 16 hours with your kid, you're tired, you want to go home, you want to rest. And that's what the Ronald McDonald House, to me, does for those families.
Absolutely, and there are usually other siblings involved, and the stress of parents having to worry about who takes care of those children. We encourage siblings to stay, other family members, again, for that support system. And we enable them to worry about their child and not those details about, I have to do the laundry, I have to worry about what to feed them in a healthy meal. So that is our mission, that if we can relieve any of those burdens, we feel like we've done the best for that family we can do.
Yeah, I mean, if you think about it, being a parent, that's the toughest job you're ever going to have. And if you got more than one child, oh my goodness, you got to manage that. And then if one of them is sick, then you've got the concern of them being sick. And now the rest of this still has to go on while you're managing, you know, in your heart, the health of your child and wishing them to get better, but all these other things are still going on.
That's true. And I think, say, the most well-known of all of our programs are the Ronald McDonald Houses, but we also help address keeping children healthy. We have 2 Ronald McDonald Care Mobiles that are 40-foot-long pediatricians' offices, and we bring free health care to our most vulnerable children in DC wards 5 through 8 by bringing the health care to where they live and where they go to school to remove that barrier.
Wow, and in fact, you see Ronald McDonald on the outside, that kids would want to come in. Now, I understand you guys are expanding, and tell us about that.
Well, the good news, bad news. The good news is that with treatments, that more and more children are able to be helped. However, with the limited number of rules, we've been having to turn away more than 200 families. So we decided that to do that, we really needed to expand and renovate both of our Ronald McDonald houses. So, you know, why not do them both at the same time? We're doing the Washington, D.C. house now, and then as soon as that reopens, we'll close and do the Northern Virginia house, and we'll expand up to 56 bedrooms to help even that many more families and children.
You guys have had a lot of successes. What are some of the challenges for you?
Well, of course, the challenges, and particularly in today's world, in this COVID pandemic, is that we had to rethink how we could offer services. Of course, the houses still have families, but under much more stringent infectious disease control and distancing, and we have the same challenges as how do you maintain those safe distances while keeping them fed and extra cleaning. We also were not able, for the safety of the families, again, our most vulnerable in downtown DC areas, and the healthcare providers, to repurpose the care mobiles. So rather than bringing the children on those units, we've moved to telemedicine, and this is with Georgetown MedStar University Hospital pediatric team. They're fantastic pediatricians and healthcare workers. We quickly, though, realized that these same families were the most vulnerable during this COVID pandemic, that they couldn't go out to get food. There is food scarcity. So we repurposed those units and have been delivering food and medical supplies, and they're not just medicine, but diapers, much needed to these same families, while continuing to treat them as best they could.
You know what? I like the fact that the Ronald McDonald House has been able to adjust to the situation and respond to what's going on and still provide services. If someone wanted to know more about the Ronald McDonald House, how would they find out?
Well, of course, you always go to our website, which is rmhcdc.org, and there's a list of ways to help with our various programs.
Good,
and
great.
we still need that help. We're still operating despite the restrictions.
All right, so they still need your help. They're still doing great things, and we want you to get involved with the Ronald McDonald House. I'd like to thank Karen Torres, Ronald McDonald House for the Washington, D.C. area. For Impact Moment, I'm Alvin Jones, right here on DCTV.
Food,
air, and water.
shelter.
We all need these 4 bare essentials for a basic standard of living. As COVID-19 continues to blindly uproot our country's everyday life, access to these basic necessities is all but disappearing.
Unfortunately, the stimulus package aid from our government isn't as impartial as the virus, failing to help countless members of our community who need the support most. That's why CASA has created the Solidarity Fund.
We are all navigating our way through this global crisis.
We are in this together.
We are all in this together.
We are all in this together.
Every day here in America, when the clock strikes midnight, literally people don't realize that 700 children are entering our foster care system. The sad part is that it's done so quickly that these children are removed, and what they grab is they grab literally a trash bag to put their belongings in. All of our donations come from people all over the world. We have given out over 100,000 cases to all 50 states, DC and Puerto Rico. We make sure that every child gets their own toothbrush, their own toothpaste, their own dental floss. We give every kid a book. Everybody gets a stuffy. I don't care if you're a newborn up to the age of 19. We all love a good stuffed animal. We realize that we're in this together. Go to comfortcases.org. Spread the word.
Hi, I'm Julia Reardon, Grants Manager and Associate Producer at DCTV. Thank you for joining us on this special day of programming as we pay tribute to the amazing and critical work that nonprofit organizations are doing to make an impact in our community each and every day. The DCTV Grant Program was established in 2019 to help nonprofit organizations to learn marketing communications best practices and to provide digital media assets to help them in telling their story. Each grant cycle is 1-year-long program. We launched our first cycle in August of 2019, and amid the global pandemic, we welcomed a second cycle of grantees that we are thrilled to formally announce here. These are the recipients of the second cohort group of grantees who joined us earlier this year. Despite the COVID-19 pandemic, we're pushing forward and helping grantees now more than ever to find innovative ways to make impact during these times. So, congratulations to our second cohort grant award recipients. We invite all nonprofit organizations who serve the Washington, D.C. community to apply for the DCTV Nonprofit Capacity Building Grant. We award grants twice a year, in January and in July. If your organization is interested in applying for a DCTV Nonprofit Capacity Building Grant, please visit us online at dctv.org/grants to find out more about the program and how to apply. You can always sign up to attend one of our info sessions to get an in-depth overview of all this grant has to offer. Let us help your organization to tell quality stories about the important work that you do to make a positive impact in our community. We look forward to working with you.
Can you imagine a world where there are no more color lines? A world where people are just people, free to follow our dreams, free to just be free. A world where we are not defined or categorized by the color of our skin. At DCTV, we believe it's time for change. It's time to erase the color lines. It's time to fix humanity. We are pleased to partner with DC-based international recording artist Silver Logan Sharp in the world premiere of a movement for change. No more color lines. This is meaningful media. This is impact for change. This is DCTV.
Imagine, yeah. Close your eyes and imagine. Imagine no more color lines. Imagine no more reasons why you can do anything you try. No one has color for skin. Color for skin. Imagine a place where everyone only stands to win. Some of us call our world a peaceful place, but if you could go back, think of everything you tried. Imagine if your first thought was to find a resolution. Some of us think we can't change anything, but if you could do it differently, what choices would you make? Imagine no more color lines. Imagine no more reasons why. You can do anything you try. Imagine your dreams coming true.